Hello, everyone. Today I will be presenting my topic of intimate partner violence for CRIM 4920. Now, intimate partner violence is a public health problem that affects millions of people of both emotionally and physically. And intimate partner violence is a physical, sexual, or psychological harm by a current or former partner. Studies have shown that people who experience intimate partner violence at a young age have an increased chance of experiencing it as adults. There's also a cultural factor to intimate partner violence because men feel like they're dominant over women, and because of that they're seen as the main perpetrator for intimate partner violence. Studies have also shown that low-income communities or communities with people of color, they're also at a higher risk of intimate partner violence because they lack the resources and representation to fight against IPV. For my theory section, the authors Powers, Concran, Masculine Sellers examined if the social learning theory can explain intimate partner violence. In their study, they surveyed about 2,500 students, and these students had to talk about the times they've experienced intimate partner violence from their significant other. And mostly half of them reported high levels of violence and abuse from their intimate partner. And these results also found that students who experience this type of violence have a chance of experiencing again later on. The second theory by Gareth Smith, Gregory, and Shoney examined if the social disorganization theory can explain intimate partner violence. And within these participants, the authors made a hypothesis that juveniles who live in these social disorganized communities have a greater chance of experiencing either IPV or violence. And the results did show that because there's a lack of residential involvement within the community, there's that disorganization and a greater increase of intimate partner violence. For a method section, I interviewed two people. That was my neighbor and a LA Sheriff's deputy. My neighbor mentioned that intimate partner violence happens when two people in a relationship fight, and that fight leads to verbal or physical abuse. The LA Sheriff's deputy mentioned that IPV is a law enforcement code known as 273.5, and it basically makes it illegal to hurt your significant other or someone you know closely. For the third research method, I did a content analysis of a local newspaper in my area in La Puente, the San Gabriel Valley Tribune. And within the years of 2015 and 2020, intimate partner violence came about 25 times, with 2018 being the highest amount of intimate partner violence in this community. From the three methods, the social learning theory and the social disorganization theory were correlated to these methods because the sheriff deputy I interviewed mentioned that there's a cycle of children who learn behaviors and attitudes from other people, and because of that they transfer it into their community or they grow into them as adults, and that can lead to crime. My neighbor talked about the local children that live in our neighborhood who learn bad words or bad behaviors from other kids, and that leads to even more trouble in our community. And it just creates this big, cycle, or this big role of children learning different things, and most of those things tend to be negative, and they bring it back to the neighborhood, and those are experiences or behaviors that could lead into adulthood and could get them into trouble, really, if there's a lot of violent behavior involved. For the approach section, I studied about the acceptance and commitment therapy for partner aggression. This is a prevention intervention approach for intimate partner violence, and it's basically an emotional behavioral skills enhancement program, and it targets adults who engage in aggressive behaviors with their partners. The program is effective in decreasing aggression in participants and help prevent victimizations. The main component is a 12 weekly 2-hour group sessions that focus on emotional and behavioral practices. A study conducted by Harvey was done on military personnel who abuse alcohol, and because of the alcohol abuse they also abuse their partners. And the ACT program, it helped create a mindfulness environment and acceptance process and the limit of alcohol usage. It provided brief therapy and long-term treatment to the military setting where soldiers learned skills such as short talk and group exercises, and participants overall experience improvements in alcohol and drug use and aggression which showed that the acceptance and commitment therapy really worked for these soldiers who abused alcohol and abused also their partners. That does conclude my presentation, and thank you.